most of us are always confused about the correct hair loss treatment because we have got so much information now on Instagram, YouTube, Facebook, different websites, social media, that we get confused on what to believe, what not to believe, what to try and how to go about it. So I thought that let's make a video where I discuss all the treatment options and tell you with a scientific backing that what is known to work and what is experimental and what is not known to work, and which treatment to choose in what kind of hair loss. So if you are suffering from hair loss and you are researching about the various hair loss options, the treatment options, then this is the video for you, because here I'll be discussing everything about hair loss treatments in a short time. So it's a brief video as in it's gonna be a 10-minute plus video, but you will get lots and lots of information. My name is Dr. Gaurang Krishna and I'm a dermatologist and a hair transplant surgeon at Medlinks, New Delhi. So without further ado, let's start with this video where we'll be discussing about various treatment options for hair loss. See, primarily there are two kinds of treatment lines. One is medical, one is surgical. So medical treatment means non-invasive treatment for hair loss, which includes medicines, lotions, minimally invasive injections, etc. And surgical, which is basically hair transplant. So where do we use medical treatment? So these are the scenarios where we use only medical hair loss treatment and not a hair transplant. And these are, number one is hair thinning. So there is a difference between baldness and hair thinning. Hair thinning means you have hair overall, but the hair individually have become thin. The number has not gone down or has gone down not drastically, but the hair quality has changed. The hair has become thin. So that is what we call hair thinning. And in this scenario, we do not do a hair transplant. We do medical treatment to thicken up the thinning hair and thus restore your hair volume. Second is just hair fall. So see, there are two separate things, hair loss and hair fall, and we have discussed that in the past, that hair loss means baldness, thinning, everything. Hair fall means hair shedding, your hair is falling, and that could be because of things like post-COVID, after any kinds of fever, seasonal change, periods of stress, periods of severe diet. So just hair fall. And in such scenarios, we do not want any medical treatment because this is most of the time reversible hair loss and the hair that is falling will come back. So if you are having just hair fall without any reduction in volume and it is something which is happening over a very short period of time, should not consider doing a hair transplant. Loss of volume, again just hair thinning where you are losing volume, then medicines and other medical options that we will discuss will be enough to give you a better volume. Very early male pattern hair loss, again many of my patients come at the age of 19, 20 with just slight recession of hairline and they start seeking a hair transplant. Well, through this video, of course, when they come, I tell them personally, but through this video, for the population in general, I would like to request that if you are below 25 years of age and you have very mild hairline recession, then do not think of a hair transplant unless it's a professional need for you. Then there's a thing called DUPA, diffuse patterned alopecia or diffuse unpatterned alopecia. Basically, you can call this diffuse thinning, where hair everywhere is getting thin. Particularly this pattern we see in ladies, female pattern hair loss. So in this scenario also, we do recommend only medical treatment, and transplant or surgical treatment is done under very specific scenarios. Then there are diseases which cause hair loss like alopecia areata, where you develop coin-like bald patches. So in this scenario also, though the area is totally bald, we do not recommend a hair transplant. We recommend only medical treatment because this problem responds to medicines, and hair transplant is not the right thing to do because even transplanted hair can get killed with the disease process. So in disease-based hair losses like alopecia areata, medical treatment is the treatment of choice and not a hair transplant. So surgical treatment is done for baldness, where a small area or a big area, 2 cm broad area or full scalp has gone bald because of male pattern hair loss, then a hair transplant is done. When the hairline has receded and the forehead is looking too broad, then a hair transplant is done. When you have a genetically broad forehead, you always had a broad forehead, and we do this a lot in ladies as well, which is called forehead reduction. Forehead reduction traditionally was an invasive procedure, but now through hair transplant, we are doing it in a minimally invasive way. So when you have a genetically broad forehead, then a hair transplant can be done. Traction alopecia, where the person ties his or her hair very, very hard. Because of the constant pull, the frontal hairline goes back. So that's called traction alopecia. That can be treated through hair transplant. Scars and injuries. So if you have a burn scar on the beard, eyebrow, scalp, any hair bearing area which has a burn scar, acid scar, any kind of accidental scars, surgical scars, then these things can be covered through a hair transplant rather than going for a scar revision surgery. So these are the scenarios where a hair transplant is best suited and medical treatment does not work that well. Now we'll discuss the treatment options. First, we'll see the medical treatment. We can classify medical hair loss treatment into home-based treatment, where you treat yourself at home after, of course, consulting a dermatologist, or clinic-based treatment, where the treatment is done in a doctor's office. So home treatment first, because this is the most commonly prescribed hair loss treatments. The most scientific, the best, most effective are DHT blockers. So primarily two DHT blockers in allopathy, finasteride and dutasteride. So these are the two most common DHT blockers. These are pills also available in the lotion form. So that we use to reduce the culprit hormone, and that's DHT, and that's why the name DHT blockers. So these are pills which reduce the amount of DHT in your body. For example, finasteride, that reduces it by 50%, dutasteride, that reduces it by 80 to 90%. So depending on the extent of hair loss, the kind of response that you are getting to medical treatment, we choose one of them. Of course, being hormonal medicines, hormone blocking medicines, these are not free of side effects and you can't take it on yourself. It has to be done under supervision of a dermatologist. Number two, and the most popular, is minoxidil. This is the age-old medicine that has been used for the last 30 years in hair loss problems. Minoxidil, as we all know, is available in the lotion form, but now tablet is also available, and we have started to use the oral medicines as well of minoxidil, but we'll talk about it later. First, the lotion. Now, lotion is a mild treatment. It is a vasodilator. It increases blood flow on the scalp. It regulates balances your hair cycle, and thus it prevents loss or hair fall. And it also gives you small baby hair. That's called hypertrichosis. So minoxidil is a recognized part of a good hair loss treatment regime. However, it is not as effective as the DHT blockers, but it's a good adjunct, a good adjuvant. Available in 2%, 5%, 7.5%, 10%, even 12.5% is available now. We do recommend 5% only, both in men and in women. In men, we use twice a day. In ladies, we use once a day. But this remains one of the most commonly prescribed hair loss medicine. Third is low-level laser therapy, wherein there are laser caps, laser helmets, laser combs, which emit a red light of a certain wavelength. This light is absorbed by the hair follicle. The hair follicle is heated up and it stimulates the roots. That's the theory. It's not as effective as the recognized ones, but recently again FDA approved for male pattern hair loss, and people who want to use it can be done. Particularly, I recommend it to people who can't tolerate minoxidil. When it is causing too much itching, you don't like that oily scalp of, you don't like that appearance of oily scalp once you have applied minoxidil. So then low-level laser therapy is used. It is basically a home treatment. It's available in the clinics also, but I recommend my patients just buy a laser cap or a laser helmet that's available online and use it at home. So it is to be used around 15 to 20 minutes, 3 times in a week. That's how it's used. Fourth is micro needling. Again, of late, a lot of talk is being done about micro needling, what you have known already as a derma roller. So you have seen the ads on social media about it. It is good. It's a good treatment, but it's not as good as what it has been hyped about. So basically, micro needling means giving controlled trauma. A roller, a drum kind of an instrument with multiple small needles that you roll on the scalp, something like sharp combing. So when you do it, there is micro punctures on the skin that increases blood flow. It also releases platelets, some growth factors, and thus it may promote hair growth. Again, very, very mild treatment. And then comes traditional remedies like onion juice, castor oil, other irritants. There are some Ayurvedic products which are used to promote hair growth. These are all good. Again, not very strong, not very effective, but these are good add-ons that can be used by a patient who wants to try these things. Now, there are certain newer things that are coming up, and as I told you at the beginning of the video, is that every month a new product comes. Every month we see a new ad of something a more fancy lotion, a magic potion for hair loss. Well, I'll tell you, there is no magic potion for hair loss. Things like Redensil, Procapil, other so many peptides are there. They are again good. There are some studies which favor that they may do something when a person, so they may have some role in hair growth, have some role in reduction of hair loss. But these are mild treatments. These are used as an add-on to the main treatment. Also, people who can't use minoxidil because of the problems of that lotion, come to Redensil and Procapil as an alternative. So now some new information for you. There are some newer treatments which you can call experimental treatments that are being used for hair loss, male pattern hair loss. The first of this is nanofat. The theory is that your fat cells, your adipose tissue, has stem cells. So when you take out fat from here, from your abdomen for example, and you process it in a laboratory, you will get stem cells which when injected on the scalp will produce a hair cell. In my opinion, that's where the future of hair loss treatment resides, but as of now, pure stem cells are not available for clinical use. So we are using nanofat in certain scenarios as a trial where we take fat from your body, most commonly the abdomen, we mix it in a tube and we make an emulsion of fat, let's say churned fat, which is called nanofat. This nanofat is injected on the scalp and again it may release stem cells, may improve hair growth. Nothing substantial right now, but it's a trial that is sometimes done. Number two are threads. Basically, these are called PDO threads, which are used for stitching and some skin lifting procedures. So some people are using it again as an experimental thing for hair growth as well. The theory is that once you put a thread inside the scalp skin, there can be some growth factor release, improvement in collagen synthesis, and thus improvement in hair. I personally do not use it in my clinic, but some people are using it, and we'll see how the results come. Stem cells, as I told you, the future lies here in stem cells, but as of now, the stem cells that are being promoted are botanical or plant-based stem cells, which will not work much on the hair growth. Is not something new. We have been using it. We used it, let's say 10-12 years back, but most of the dermatologists have almost abandoned using plant-based stem cells now because there is no evidence, and personal experience also didn't help much. Exosomes, a lot was talked about exosomes in conferences, etc., in seminars. It held some potential, but because of exorbitant price and groups that use exosomes now reporting that the results were not very exciting, lesser than even PRP. So the use of exosomes have become very, very limited in clinical practice now. Coming on to surgical treatments, the most common ones, as you all know, is FUE, follicular unit excision or extraction, and FUT, follicular unit transplant or strip surgery. Sometimes we use a combination of the two, where we do both FU and FUT, wherein we need a lot of grafts, 6,000, 7,000 grafts, then we do a combination. As of today, the most popular one is FUE because it is less invasive, more comfortable, we get a decent, good enough result. Few years back, FUT was more popular because FUE was, we were just beginning to use FUE. The hands were not that set, the instruments were not so nice, and we were doing 1500, 1800 grafts. For more grafts, we used to do FUT. But now in last 8-9 years, the things have changed. We are getting better instruments. We are more, the expertise has developed, and we are easily doing 3000 to 4000 grafts with FUE alone. So these days, FUE is the more popular technique, does not make FUT a redundant or an obsolete one. It still holds a lot of promise. We use it when we need a lot of graft, we use a combination of the two. Then another important thing for you to know, because many people get confused here, is about hair weaving. Now hair weaving or a hair patch is not a medical treatment. I don't call it a treatment. It's a wig basically. It's a non-surgical management of baldness, wherein you get a wig which is pasted on your scalp. That is basically a hair bonding hair patch. Hair weaving, along with the wig, the patch, the cloth is stitched at the back of your scalp. A bead of your hair is made and the patch is stitched into it, and that's called hair weaving. Why I'm talking about this is because still many people, many of my friends ask me that, Dr. Gaurang, let's do hair weaving. I'm balding, do my hair weaving. They mean hair transplant, but they use the word hair weaving, and these are two totally separate things. Hair transplant is a doctor-led procedure, it's a minor surgical procedure, whereas hair weaving is a parlor-based procedure, wherein you are pasting a wig on your head. Then there are certain medical clinic-based treatments, and the most popular is, as we all know, PRP, platelet-rich plasma, and it has become very, very popular now. Again, it is not as effective as DHT blocker, but it's a very good add-on to your main hair loss treatment. In this, we take 40 to 50 ml of your blood, we process it in a machine and get platelet-rich plasma, which is basically a platelet concentrate. So your blood has a cell called the platelet, which stores the growth factors. So when we make PRP, we concentrate your platelets, activate them and inject it on the scalp. So your hair, they get a dense source of growth factors which stimulate the hair root and make the hair look better. Word of caution here is that it is not as effective as DHT blockers. DHT blockers remain the most effective male pattern hair loss treatment. Number 2 is PRP. Third is something similar, growth factor concentrate, commonly called as GFC, which is again a blood product, but here a special tube is used which makes the growth factor solution total cell-free, acellular, and that makes the treatment less painful. So that's the main difference between PRP and GFC, is that GFC is made through a special tube which gives us a pure growth factor solution which makes the treatment painless. Mesotherapy is basically injecting vitamins on the scalp. Information here is that, see, technically, whenever you are injecting anything in the skin, it's called mesotherapy, anything. So even PRP for that matter is mesotherapy, GFC is also mesotherapy. But as a convention, when vitamins are used, when vitamins are injected on the scalp, that is called mesotherapy, and we'll stick to that. So mesotherapy means injecting hair growth vitamins in the scalp. Good add-on, but not super effective. I don't offer it to my patients routinely. Only when we have exhausted everything, we are doing DHT blockers, we are doing PRP, doing minoxidil, and we still want something more. Then mesotherapy is offered, but these days the use of mesotherapy has gone down. Microneedling we have discussed, same as home microneedling. There is clinic-based microneedling. Here you can go a bit more aggressive. You can use a bigger derma roller like 1.5 mm. You can give more trauma to the skin, primarily because in a clinic there will be a doctor who can numb the scalp. And that's why that is the clinic-based microneedling. Now comes the most common scenario, is a combination of medical and surgical. And this is the most common scenario, guys, because most of you, if you think about it, most of our patients, most of you who are suffering from hair loss are not fully bald or not bald at all, no hairline at all. Most of our patients are grade 2, grade 3, grade 4 male pattern hair loss, where they lose hair from the front and have good hair at the back, or vice versa. They lose hair from the back and have good hair in the front. So this is the most common scenario, and because we want to treat the bald areas, we want to grow hair in the bald areas, and also we want to prevent loss in the non-balded areas, or let's say the balding areas. That's why we do a combination of a hair transplant and medicines. So hair transplant for the bald area and medicine to prevent further baldness. I'll take 2 minutes here. Let's say, imagine a patient with grade 3 male pattern hair loss. He's bald from the front and has good hair at the back. Of course, we want to grow hair in the front and we do a transplant in the front. He looks nice for a couple of years, but then this area starts balding. How do we prevent that? We prevent that through medicine. So he will need transplant and medicines also. Conversely, grade 3 patient, baldness in the front, good hair at the back, let's say thinning hair at the back, we just do medical treatment. His back hair gets better, but nothing happens on the front. So what we do about that? We do surgical treatment. So most commonly we do a combination of the two. I hope I made the point clear. For example, this patient. So here we are looking at a grade 3 male pattern hair loss. So to treat this area here, we want to put hair. So a hair transplant. But to improve, or let's say maintain these hair, medicines. And that's when we get a head full of hair through a combination of hair transplant and medicines. Another new thing that you need to know is a combination of hair transplant and hair weaving, hair patch. So when a patient comes to us with extensive baldness means a big area of baldness, big area to cover with a limited donor area. And the patient wants fullness everywhere, then a hair transplant is not enough. Then we do a combination of hair transplant and a wig, wherein we do a hair transplant in the front to give a nice natural looking hairline, and we paste a patch at the back, a hair wig at the back, so that it gives him fullness. As of now, there are very less takers for this idea because most of our patients, they either want to do a hair transplant. If not, then they would go for a wig or just let it be. There are few patients who have a professional need or otherwise as well. They go for a combination. Front is a hairline hair transplant and back at the wig. So we get best of both the worlds. So I hope this video gave you some idea about how to approach your hair loss. What would be the right treatment for your hair loss? There is nothing as a standard hair loss treatment. Yeah, hair transplant or okay, medicines. Every patient needs a different procedure, a combination of procedures, a combination of treatments. So let's do a little quiz and I want you to give your answers in the comment section. Here is a picture of a patient who is not totally bald, has hair everywhere, but still looking as if the hair is very, very less. So what do you think would be the ideal treatment for this patient? And what do you think we did for this patient? Was it medical hair treatment? Was it a hair transplant? Or was it a combination of two? Please write your answers in the comment sections and we'll let you know if your answer is right, of course. And there will be a lucky draw as well. If you have given a right answer, you stand a chance to win a very nice goodie bag from Medlinks. Thank you so much. I hope you enjoyed watching this video as much as I have enjoyed making this video. Thank you till we meet again.